So Dr. Rass was, he got ill unexpectedly, so he's not going to be here. So I kind of incorporated some of his pictures and some of the things that he was going to say into this presentation. So he's sort of here with us. So this is the history and future of ASIPP. It's an action-packed story with adventure and nail-biting, hair-raising, gut-wrenching moments, disbelief, sighs of relief, and tears of joy, and prayerful nights. Because remember, today is the National Day of Prayer. And so we should keep that in mind. It's an important day for this country. So we also have moments of amazement and grateful hearts. So in the beginning, you've seen this, a few of these things earlier, but this society wasn't always called the American Society of Interventional Pain Physicians. In the beginning, it was called the Association of Pain Management Anesthesiologists, and they decided that that wasn't inclusive enough because there were people that weren't in anesthesiology that did some of these procedures, hence the new name. And I will tell you that inclusivity and diversity remain as the mainstay for this organization today. And I tell you that because I'm a radiologist, and I did an interventional pain management fellowship, but I was welcomed with just open arms into this society, as have a lot of other radiologists and other non-pain physicians who do these procedures. You can't imagine what that feels like, and that was primarily due to you guys, but especially to Dr. Mangiaconti. So the pictures you're seeing are original pictures with Dr. Rath and Dr. Raj and Dr. Mangiaconti, and then you've seen that picture of the families before. I think we have to coordinate these so we don't duplicate. Up in the corner, you can see Dr. Benyamin and Dr. Mangiaconti doing some procedures at some of the cadaver workshops that we're doing. We actually offer over 125 courses, all kinds of cadaver workshops, hands-on ultrasound courses. Now you can see that ultrasound is the next picture. That's me having a bad hair day at the ultrasound unit, and Dr. Mangiaconti's looking on. So we also offer regenerative medicine courses, review courses, and the ASIPP examination and preparation courses. And if you look down at the bottom, that's one of our upcoming courses. We offer ASIPP Part 1, ASIPP Part 2, an ASIPP competency examination. We have several competency courses. The three most, the newer ones are the regenerative medicine competency exam and the lumbar endoscopic decompression course and the fluoroscopic interpretation and radiologic safety course. But notice on the regenerative medicine competency exam that that was the first of its kind, which is usually what ASIPP does. So these are just examples of people getting Lifetime Achievement Awards, Giants in Pain Medicine Awards. ASIPP really developed and advanced the evolution and development of interventional pain management, and that's what it's done since its conception. Dr. Mangiaconti and ASIPP in 2002 worked with the Centers for Medicare and Medicaid, and they recognized this specialty of interventional pain management. And you saw earlier where people were telling you about the coding, the specialty coding 09, and that you should really be using that in lieu of the other, I think it's 72, because you make more money if you use 09. And it also supports the specialty. In 2005, we became part of the Medicare Carrier Advisory Committee, and Dr. Mangiaconti and I think Dr. Soin told you how important that is because we have a say in what will transpire regarding this specialty, which a lot of other subspecialties don't have that. So we're very fortunate. Dr. Mangiaconti and members of ASIPP have written countless letters, so have our patients. They've written them to the Centers for Medicare and Medicaid, HHS, all the Health Care Financing Administration. They've written them to the House of Representatives, to the Senate, just enormous numbers and volumes of letters. And like I said, when they were threatening to get rid of or to seriously injure epidural steroid injections, we had 10,000 or more patient letters that were written in to our senators and our representatives. On behalf of patient care, you can see down at the bottom and over at the top, both Dr. Benyamin and Dr. Mangiaconti actually speaking at congressional hearings on behalf of interventional pain management. So now you can see up at the corner, that's actually where Dr. Mangiaconti received the pen that then President Bush signed the NASPR bill with, and his friend, Representative Ed Whitfield. And I say friend because one of the really special things about Dr. Mangiaconti relative to all of this advocacy is, some people make acquaintances, but Dr. Mangiaconti and some of the other members of ASIPP have taken the time to make friends, and that means they work with each other. It's not just what can you do for me kind of relationship, and I think that that's remarkable. And Representative Ed Whitfield was a true friend, both to ASIPP, but especially to Dr. Mangiaconti. So you can see that that bill got signed by President Bush in 2005, and then it was reauthorized in 2021. So all of these things are just everyday occurrences for ASIPP. You would be horrified if you knew the number of efforts to decompress our procedural list or to do damage to interventional pain management. And so ASIPP is always on the front trying to stop that, trying to slow that. We try to stop it if at all possible. So letters are written, phone calls are made, always on behalf of our members and our specialty. We have a lot of guidelines that have been written, and these are a few of them. Down at the corner, you can see a list of them, and you can go onto the website and access those. Those are free for people to access, and they're very important. When you do a guideline, the rest of the medical specialties notice that, and a lot of them refer to these guidelines. It takes a lot of work to write these guidelines, and it's one of the many things that ASIPP does on behalf of our specialty. We did a special issue of Pain Physician on COVID during the time when it was at its peak. We tried to come up with a lot of different ideas to keep both you, the physician, and our patients safe. We wrote a lot of different items to help with that and to ease some of the burden that all physicians were experiencing. This is just one of the courses that was offered. There were quite a few courses and quite a few articles that you could refer to. These are some of the things. This is just another access of commitment or showing a commitment for ASIPP relative to our members. So up the corner you can see that there's an ASIPP TV. You can have those in your office. A lot of people like to put their patients talking about the procedures that they've had and how they feel about the procedure or their experiences. Sometimes you want to put new procedures so that patients can look at that and get an idea about it. You put interesting conversations with other physicians maybe on these, but it's a nice way to calm your patient down and make them feel like they know a lot more about some of the procedures that they may be going through or maybe thinking about going through. Then on the website, there's e-news, ASIPP e-news, and that's a very valuable informational site for you guys. That's free, just go on there, and we try to keep you updated on all the things that are transpiring, and for the good or for the bad. ASIPP formed a partnership. I think Dr. Soin told you about this earlier, but essentially one of the things that happens is that we get Omnipaque in smaller vials for a lot better price than you can get anywhere else. And the Fedora Billing is a revenue cycle management company. That's who Fedora is. And they also give special rates for ASIPP members. These are just a list of all the different resources that you can have. And you can see on there that there's a members only section. And in that section, that's one of the places that you'll find the Amazon store, but there's a lot of things in there that you have to be a member of ASIPP to be able to access. There's an ASIPP podcast with you can see two of our wonderful members on that advertisement there. There's the 2022 fee schedule. And believe it or not, a lot of different pain societies use this fee schedule. So we are thinking of moving it into the members only because it's a very important document. You can see that down at the bottom corner, you can see there's the app that Dr. Soin and Dr. Manchikanti and others put together so that you can access the antithrombotic guidelines much easier and quicker. Again, down at the bottom, I've made reference to this before, but this is an on-demand video that you can watch, and it was excellent. I was there for the original virtual program. Pain Exam partnered with us, and for anybody who has to take the examination or who's thinking about taking the examination, if you haven't already, the ASIPP examination, that's a really good way to study for the ASIPP examination. And then, of course, there's PainCast, and that's also another fabulous informational resource. These are some of the published resources that you can purchase. Up in the top, you see the originals for the Essentials of Regenerative Medicine text, and then the Essentials of Interventional Techniques in Managing Chronic Pain, but both of those are being updated now. Then down at the bottom, we have some other reviews, the clinical aspects and foundations. And of course, over on the other side of the screen, you can see we have the pain medicine case reports and obviously our fabulous journal, Pain Physician. So this is just a slide showing you what happens when we go to Washington, D.C. And I talked to you a little bit about that earlier today, but it is a lot of fun, and it's an opportunity to feel like you, as a physician, could actually make some changes in what's going on. Because people listen when we come to talk to them. They do. And remember I said this morning, we want to inundate them with pain physicians this upcoming year because we didn't get to do it last year because of COVID. But now this upcoming year, our conference is going to be in Washington, D.C., and we want a huge group to go up to the Hill for this. It's a lot of fun. You can see Dr. Manchikanti with some of the members. Down at the bottom is McCarthy. You can see the whole group of us that went that time. But I would like that number to be at least twice, if not 3 times the number of people. So many people that we can hardly squeeze this all onto one image, okay? So that's what I'm hoping for. It really is a lot of fun. You learn a lot. You kind of feel special because you get to walk behind corridors where very few of the regular population of the United States gets to go. So it is fun, and it's educational, and you do make a difference. Now, these are some of the action lists for 2022 through 2023, and just like the ones that I showed you earlier with Dr. Soin, some of the things that he started last year aren't going to just be done in a year. So there'll be things that will carry on, and that's true also for what's up here. So one of the big things that I would like to work on with the ASIPP in general is a regenerative medicine registry. Because right now, the way the literature has regenerative medicine, there isn't consistency in what's being written. So that's an easy source for government and third-party payers to say, oh, you're experimental, or not pay attention to us for the legitimacy that we deserve. And so what we're hoping for is to provide that consistency through this registry. So there's going to be a select group of people that will be developing like a worksheet that you as participants, which I hope you will all be participants if you do regenerative medicine, because I feel that this is one way with the populace of ASIPP that we can truly make a difference in regenerative medicine. I believe that we'll be able to come up with a baseline recipe. Now, regenerative medicine is a little bit patient dependent, so it won't be a frank, hardcore, this is what you do every time, but it's a baseline from which we can start, and a lot of people can start from that source and then alter it as needed for their patient. We don't have that right now, and it'll make a world of difference how respected regenerative medicine will be. I want to enhanced. Dr. Navani was brilliant when she latched on to TOBI. That's the Orthobiologic Institute. That's what that stands for. But she wanted to do some collaboration with them, and I'm telling you, it was a great idea. They're a great organization. And so we would like to continue that collaboration with TOBI in the area of regenerative medicine. We want to honor our members that have really sacrificed, given time, worked hard, produced papers, whatever. We're coming up with the criteria that are service criteria for the title of Fellow in the American College of Interventional Pain Physicians. Now, that's going to be a deserved honor. It's not something that just everybody's going to get. So there'll be a list of requirements, and everybody's welcome to apply, but there will be a very strict list because it truly is going to be an honor for the members that achieve it. We want to increase the webinars through ASIPP for pain fellows. Like right now, we would like to involve our fellows more, give them some experience at lecturing. Maybe they do interesting cases. Maybe they do a project that they're working on, or maybe they just develop a lecture that they would like to present. But it looks good on their CV because we're a national society. It gives them experience, and then we get to see a little bit about what our fellows are doing, so that's fun. So we'd like to do that, and there's going to be a committee that's going to be putting that whole thing together. We have some new specialty courses that we would like to start, one of which is going to involve surprise or no surprise imaging, since that happens to be one of my subspecialties. But we'll try to enhance imaging for you guys to help you learn better about MRI, whether it's better to order CT or MR for a procedure, some of the limitations for ultrasound, but we'd like to get some courses up for you guys. We're going to do additional competency certifications in different areas than what we already have. I showed you that list, but we'd like to add to that. And some of it will involve peripheral stimulation. We want to, Dr. Soin mentioned to you that there's already mumblings in the undercurrent for SI joint procedures. And one of those involves a difference between posterior implantation of these little, future fusion peg versus a lateral approach. And the lateral approach is primarily used by the surgeons. And we and other interventionalists are the ones that, or minimally interventional, use the posterior approach. And you know, these people think that there's not enough pie for everybody. But there is enough pie for everybody. They want to take that over. They don't want to legitimize that procedure that a lot of our members are already doing. So we will fight them on that. You heard earlier, and tomorrow I'll actually show you what's written in that bill that almost passed for Louisiana. But they wanted to limit who was going to be able to, it was orthopedic and neurosurgeons who wanted to limit who was going to be able to do these spine procedures. Now, Dr. Soin made kind of a joke since they were not politically correct and they didn't put he, she, they just put he. So I guess we could capture that as females in interventional pain medicine, take advantage of that, but we love you guys too, so we're going to fight for everybody. So I would like, some of you have already heard Dr. Manchikanti's lecture on the fourth wave. It was one of the best lectures I've ever heard him give, and he gives a lot of really good lectures. But this one was horrifying, and it had facts and information that I never even thought about. I would like that to go more on a public scale so that people really understand what is going on in the background and directly affecting interventional pain medicine. I want to increase the public awareness of interventional pain management, interventional pain medicine, because having friends that required pain medicine procedures, when I would first bring the subject up to them, this is how they would introduce their ailment. Sheri, what do you think? You think I have this problem with my back. Do you think I should see an orthopedist, or do you think I should go to a neurosurgeon? And I'd say, explain to me again. I'd say, no, you don't want to go to an orthopedic surgeon or you want to go to a pain medicine physician who does interventional pain medicine. That's who you want to go to. And they go, what's that? And I can't believe, well, you know, I'm biased because I'm involved with the society, but I'm sure that they are not alone in not knowing what interventional pain management or interventional pain medicine is. So I want us to work even harder to make the general public of the United States and wherever else aware of what we do and how important what we do is. I think somebody said earlier today, some of these procedures, these surgical procedures, I think it was Mr. Alvarez said maybe they didn't even need if they'd have known about interventional pain management before they started down the surgical route. We have the members only section that I was telling you about, but we would like to add an imaging section in there as sort of like case of the day, or what do you think this is, or these are interesting, or how do you tell this from this? Something very quick that everybody can benefit from and learn from. Up above that, you saw, as part of the increase in public awareness, Dr. Soin and I had talked earlier about YouTube channels. And the reason I had mentioned that to him earlier was when I went on YouTube, because they have a lot of very valuable pieces, some not so much, but they do have a lot of valuable little clips that you can look at that tell you about, you know, how to plant a particular shrub, or who does this kind of a procedure. But when I looked for specific things to help the friends that I was telling you about so that maybe they could see some of these things, I had a really hard time finding quality productions. And I had a hard time finding information about the procedures that I wanted them to understand. So I thought, well, I'm in pain medicine. Well, what does the average person experience when they try to go in? So I would like us to develop something quality related, and not necessarily as an advertisement, but as a resource of education for our patients, which, by the way, they'll appreciate, and it ultimately will be an advertisement for interventional pain management. We'll put a little bit of a helpline into the members only section, so if you